All right, guys, welcome back to another episode of the Rated RX podcast. We're here at episode 11 with a special treat for you all today. Joining us for a special episode is another pharmacist, a friend of ours, Paige. Paige is a pharmacist that we all went to school with at Creighton University. Since then, she's been killing it online, work career. Of course, we had to invite her to the show because we know we're going to be able to provide you a fun-filled episode here. Paige, please let us know, how are you doing today?
I am doing okay. I am excited to be on the podcast. I'm a little nervous, to be honest.
That's okay.
It's a safe space.
Usually work in more curated environments, but I'm doing okay overall.
Okay, great. What can make you feel better? Not just okay.
A bottle of wine and
Okay,
a babysitter.
There we go. Now,
well, we can help you with the bottle of wine. The babysitter, not so much.
You want to send Annie over?
Yeah. Next time. So, Paige, for our listeners, can you please tell us a little bit about yourself and what you do?
Yeah, I am an ambulatory care pharmacist. I work in a primary care setting, so I deal a lot with disease state management of primarily diabetes, but also weight loss, hyperlipidemia, tobacco cessation, hypertension, some COPD and heart failure. So just kind of that slew of primary care disease states. And I practice under a scope of practice, which allows me to prescribe medications for certain disease states like I listed. And it's a really fun job. I really love it.
That's awesome.
Part-time, I create TikToks.
Okay.
I have amassed, about a $2 to $10 sum of income from that.
oh, very nice. $10.
I'm a big spender, so
Get that extra large Starbucks coffee now, huh?
no,
No,
still just the
Not quite.
tall.
still just the top. At least not spending it on diapers, I suppose.
No, still doing that.
Oh my goodness. Okay, well, we're gonna get you to $100 a month to help you out here, hopefully.
Perhaps.
So tell us, how did you get into the whole TikTok scene and the whole online presence? What motivated you to get there?
I've actually been doing this secretly for quite a while, more in the mom sort of scene than anything. So when the pandemic hit, I started to download and I guess consume TikToks, and it was just kind of fun. So I posted little things here and there, and I actually grew a decent following from mom related stuff. But what
Nice.
got me into the medical or pharmacy field is my husband, Dr. Z-Need, at Dr. Z-Need. He started posting, and he skyrocketed past what I had ever amassed in following in like a number of weeks. And I was like, oh my gosh, I'm knowledgeable.
hell?
Yeah, exactly. Like what in the world? I have been posting so much and trying so hard, and he's just like gets on and very casually talks. And I'm like, I can say stuff. I'm smart. I started posting more pharmacy content, and I actually did grow quite a following from that. So I've kind of switched gears, but I'm really here for it. It's a fun and kind of more enriching environment in the TikTok. And we've also branched out to Instagram and YouTube. I still don't know how I feel
Nice.
about those, but primarily TikTok is my, chosen platform, and I really enjoy it.
What's your handle? Yeah, think about that.
Blooper.
Paige_KM, I think.
All right, listeners, you heard it. Make sure you give her a follow. Boys, you got any follow-up questions for our star today?
I guess you're talking about things taken off or individual things. Was there like one specific moment, or was it with your husband of like one thing that took off? You're like, oh man, like I could do that. Like as you're saying, or one that you saw yourself that you did that just like sparked that more of that medical side.
For the medical side, I would say more of him and the fact that doing lives, actually, which I've encouraged Robbie to do.
Okay.
And I've
That's scary.
even invited him on a co-live
She did.
multiple times.
She did.
But yeah, so you can gain, 100 followers, hundreds of followers in one live, and it's kind of crazy. And you get not that I make a lot of money off of TikTok, but you can get gifts and stuff, and you can make a decent amount off of lives as well. So him doing those and getting, some lives he gets 1,000 followers in the
Dang.
live, it kind of spurred me to shift more towards medical. Yeah.
That's what the people want.
Very cool.
What the
Nice.
people want. I give the people what they want.
So I wanted to ask you a little bit about your job. What's your favorite thing about being an AmCare pharmacist, and how is it working? You say you work a little hybrid, remote a little bit. How's that going for you?
Yeah, so I actually am fully remote, and that was something that I am living the dream. In initiation of my role, it was expected that I would be fully remote, and things are a little bit up in the air now.
Yeah.
But I love working remotely. I think that I can very adequately do my job remotely. And as far as what my favorite part of AmCare is, I think that it's just really cool to work in a side of pharmacy that most people don't know about, in being able to prescribe medications for disease states and have that really close-knit relationship with the patients. And two, I am making very meaningful changes. I get to celebrate successes with patients when, they've stopped smoking or they reach their A1C goals. It is a very fun and fulfilling job that I enjoy a lot.
Yeah, that's great.
That's awesome. Paige, thank you so much for sharing your life, what's going on.
Ready to get silly.
Now it's time to get crazy and silly, as Xavier said. So what's coming ahead here, just to set the pace, let everybody know, we got the Plan B blind draft that our boy Sam is going to be taking charge of. Then we got our pharmacy fact here. Love those pharmacy facts. I never know what Xavier is going to bring, so a lot of times it blows my mind. We got our weekly weigh-in, is when we tend to get a little serious here. Say some controversial things sometime, but that's what the people want to hear. Then of course our pharmacy pandemonium, where we discuss crazy stories. With that being said, I'm going to pass it over to Sam. Sam, please take it away.
All right, we got our Plan B blind draft. Paige, I know you haven't been a part of this yet, but we're going to have 5 blank categories that we're going into, 1 through 5. Number 1's going to be the most in this case. And kind of our topic is almost like irritating things or shocking things that a patient will come in with when you're getting on the call with them. And the first thing, you're working on that smoking sensation or whatever it may be, and they come out of the gate with this, and it's you rolling your eyes or getting irritated on what they're saying and how you're going to proceed from there. So 1 will be the most irritated, and you only get to see 1 at a time. You guys got to rank them together, and we'll go from there on going 1 through 5.
Can't wait to see how she ranks these, because I'm going to be ranking them different in my head. Like,
It's all on my shoulders too.
yeah. You're going to have back pain from carrying this team.
I already have back pain. I'm still
That's because you're
young.
above 30.
It's going to be worse. It's going to be worse.
Barely.
See, barely.
I am a
first
little
one-
older than you guys, so.
That is true. The first one here, first line that they come in when we're making those recommendations, I heard it on TikTok that apple cider vinegar works better.
Oh, gosh. I'm not even from someone who actually hears that a lot. Not on TikTok, but I heard. Not that annoyed because there is some evidence behind it. So I would rank that pretty low. I actually did a video on that. Apple cider vinegar has like mild to moderate lowering of A1. Say maybe a 3, middle of the road. What do you guys think, Xavier and Robbie?
Well, knowing Sam, I know he likes to put some really annoying stuff towards the end. If you really don't find this one that annoying or that irritating and something you really can handle, I would go a little lower, me personally.
Okay, let's go.
I don't know. I gotta say, personally, I'm a little more annoyed only because it makes me think back to pharmacy school, and I won't say his name, but he would go around drinking it before we would, go out in our debauchery. But I think you guys know who I'm referring to, right? Yeah. Well, I won't say his name on here. So that always kind of annoyed me. So I'm gonna push more on 3 personally.
Okay, let's go 4, middle of the road.
Okay,
let's go.
final answer is 4.
4.
All right, next one
Answer.
is the refill numbers are off, and your question about it, and your patient saying, I skipped my blood thinner for a couple weeks because I was flying.
That's pretty high for me because, you're lucky you're not dead. I shouldn't say that. That'll get you banned on TikTok at least.
Don't say the D
I've
word.
said worse.
I would say maybe 2. because that's pretty not annoying, just dangerous.
And we care about our patients.
We do, absolutely. So number 2 is what I was thinking.
2?
There we
Okay.
go. I like that.
Final answer.
2 final
The
answers.
danger
All
zone,
right.
number 2.
So the next one, I take all my pills once a week. I like to get it over with.
Either getting worse or worse.
If he saves it, I'm running out of room. I would say a 1 for that one. That one's worse than the blood.
And go with your
thinner
heart.
for
Go with your
me.
heart.
Number 1. Number 1.
Wow, straight to the top. Straight
Take
to
all
the
your
top.
pills once a week.
But what if he's in therapeutic range?
It doesn't
Pose
matter.
a
That's not how
hypothetical.
medicine works.
I
Robbie.
know.
You know that.
No, Robbie. She said no.
No.
Okay, 1 final answer.
I guess.
All right, so you have 1, 2, and 4. Next one, I rotate my insulin injection sites, stomach, arm, leg, and sometimes neck.
Like, it's going to be a 5. And then he said neck.
It's like a little insulin right here.
Yeah, like straight into the bloodstream.
That's right.
Probably, I'd have to give that the number 3. I think I
You
might
got 3
have,
and 5 left.
I have to do 3 because that's deadly.
Okay, you're locked into 3. So the only spot we got left is 5, and it is I take melatonin, CBD, and Benadryl every night. Is that okay?
No, but
Nice.
comparatively,
Not the worst thing on the list.
Okay.
You're pretty good.
Yeah, that was pretty good.
All right. So the order we went. Number 1, I take all my pills once a week. And I like to get it over with. Number 2, where I skip my blood thinner for a couple weeks because I was flying. 3, I rotate my insulin injection sites, stomach, arm, leg, and sometimes neck. 4, I heard it on TikTok about this apple cider.
Heard from Paige.
And I take melatonin, CBD, and Benadryl every night. Is that okay? Is number 5. How do we think?
I could have done better.
But
Which one pops to you? Which one was off the most?
I mean, you shouldn't be injecting insulin into your neck.
You're saying you think 3 insulin injections should be higher. Are you moving it above skipping blood thinner for 2 weeks and flying? You saying which one are you disliking more there?
Oh, gosh, they're both so horrible.
So, maybe 3's right. Maybe you're saying, you just don't really care that much about neck injections.
What if it was a neck injection with an IM needle?
That would be even worse. You know what?
It could always be worse.
Other than the apple cider vinegar, I don't condone anything. And this is not medical advice.
This is a podcast for entertainment and informational purposes only. It's okay.
Yes.
Full disclaimer.
Okay, good work. Good work. I think it was a pretty good list there. That's some good balance between everything. And so we will go to Xavier here and having his pharmacy fact. Take it away.
All right, guys. So I have a wild one here for you today. There's a trend going on over in Japan. I don't know, Robbie, if you know anything about it, but some people are now using the latest craze to battle bad breath. They're taking the fiery green stuff that clears your sinuses with sushi. It is wasabi capsules. So people in Japan are using wasabi capsules to help with bad breath. And some people, it's been mixed reviews. Some people says it works. Some people talk about the spicy burp afterwards, but it's not really well studied yet. But what do you guys think about it? Using wasabi pills to help with your bad breath. You got halitosis. You got to knock it out with something fiery. Forget the minty stuff. It doesn't work.
Are they saying that they're liking the wasabi breath, or it does some other sort of reaction that's making their breath better?
It says the wasabi has some possible antibacterial factors that can kill the bacteria that's causing bad breath in your mouth.
Okay.
So people have been trying it out, and it's a new fad that's going on over there. You think it'll make it to the U.S.?
I don't know, man. I wouldn't go for it. I mean, doesn't it make more sense just to kind of scrub your mouth with wasabi than take a capsule? I feel like that delivery method is a little skewed there.
Well, maybe the capsule just kind of explodes in your mouth, and then you eat it dissolves quickly, gets rid of the bad breath, then you swallow the spiciness.
Paige, would you recommend the capsule on your TikTok?
Does it taste like wasabi?
But yeah. Yeah.
So I probably, if there's not much data to support it, I probably wouldn't recommend it. However,
There's not
I
much
do
data to
like
support it.
wasabi.
Just what does your heart say? What
My
you doing?
heart, My heart says my heart says wasabi tastes good. So if you're gonna take it in, regardless, just like the apple cider vinegar, will it hurt you? No. Might it help your bad breath? Maybe. It might not hurt.
Would
Find
you
out.
be willing to take wasabi pills daily to make sure your breath is fresh?
Daily.
She
a
works from home.
daily pill.
She don't got to see no one.
The good question is, does it hurt going out?
That is very good. Where's the data? What's the data?
So, fun fact. I mean, I don't know if you guys ever saw that show, and Adam Ruins Everything. If you haven't, highly recommend. But they talk about how halitosis was actually a word made up by the Listerine company to sell more Listerine. So, there you go. It's just some marketing bullcrap word, halitosis.
It's a very real thing.
It is a
So-
real thing, but it was made for money making, for cash monies.
This is everything.
True.
So it sounds like we're all sticking to our Listerine and mints and breath strips for fresh breath.
This is a
think
good
so.
excuse for me to Uber eat some sushi, honestly.
There we go. There we go.
Let us know what you find. Let us know your findings.
All right. So I thank you guys for doing the fun fact with me today. I hope you found that very entertaining. Now we'll pass it back over to Sam again for the weekly weigh-in.
All right, we got the weekly weigh-in, and we got a username GabaLabaRX. So definitely some pharmaciness in there. And their question here, would I be an idiot not to do residency? So I attended one of the best schools in the U.S. with an 80% plus match rate, so they're probably at Creighton. So assuming I don't bomb interviews or write something stupid in my applications, I don't think it's a reach to say I'd get a PGY1 spot somewhere if I tried. So would I be an idiot not to? And they give us some extra info here. I'm in my appy year right now. Haven't had an acute care rotation, but I'm dreading it. I learned alongside a PGY1 resident who's regularly had 12-hour days, staffed every other weekend, endless projects, meetings. I can't stand the constant beeping, tense atmosphere, the death wafting in the air in hospitals. Sounds like Zaire over there. It all just sounds so unappealing. My dream is to be a part-time pharmacist at Costco, Walmart, or a nice independent compounding pharmacy. But I would also be totally satisfied floating for a major chain. Of everything I've heard about hospital pharmacy, working independent in the basement of some sort of hospital sounds mostly up my alley. My goal is to have a peaceful life, never bring work home, and only work 4 days a week. But I recognize that I'm a young and naive, so I would love to hear what you all think. So would they be an idiot not for going to residency? Paige, any thoughts on that?
I mean, if their goals are community pharmacy, I don't think you need to do residency. So no.
It seems relatively pretty cut there with the way they're explaining things on what they want.
We'll say I did residency and I work 4 days a week, but full time. And I don't bring home anything. And hardly anyone yells at me. So, it's pretty chill, but I'm also fairly social.
What about during your residency year? What was that experience?
I mean, it was fine. It wasn't a hard residency compared to some others, but it wasn't like a cakewalk. If my only goal though was retail pharmacy, I never would have done a residency because you're missing 1 to 2 years of earned income. You're making nowadays maybe like $50,000 to $60,000 a year versus over $100,000 a year as a starting retail pharmacist. There's no reason to do a residency and take away that income if that's the goal.
Sure. Money's definitely a factor. Robbie, thoughts on residency?
Yeah, so speaking for myself, I did a community residency. Community residencies are geared a little differently because everything, at least mine, everything was longitudinal. So instead of doing everything by block, you were juggling 5 experiences at once throughout the year. So in a sense, it was great because I kind of learned how to organize myself, even though I'm still not the best at it. But I did it thinking I was going to own a pharmacy. And I think that if you are going to own a pharmacy, it's probably a great idea to consider a community residency. But, I now work at a psychiatric hospital, completely different from what I thought I was going to do. And I only got that job because I got a residency. So you speaking for this person, what you think you might think you want to do is going to be completely different when you're actually doing it. So I only know people who regret saying I didn't do a residency and now they're locked in doing community pharmacy, hating their life. Of course, there are unicorns out there working at an independent. I know Sam does compounding. I know he loves his job, but that is a very, very slim amount of people and not compared to the majority. So, I mean, I feel like you worked 4 years and you went to pharmacy school, and that wasn't by any means easy either. So it's like, why quit in the last year? You know, it's like at the final quarter. So I don't know. That's my 2 cents there.
Okay, some good insight there. So, Paige, having done your residency and experienced different, and it sounds like some of your TikToks you talk about having residents or either ones that you have to teach or see. Do you think it really matters where residents go and those different options out there?
I think that to some extent, it does matter. You need to be able to speak to your experience, but unless you're going to like an Ivy League or very prestigious residency program, they're not going to know the difference between, a random hospital in Illinois versus a random hospital in California. So I don't think to that extent it does. If you get into like the Mayo Clinic or like Stanford, probably it would speak more to your total, career outlook. But other than that, I don't think it matters all that much as long as you had an adequate training at that program.
Okay, so pretty across the board. Sounds like relatively good standards that you're seeing for you experienced and residents that you see that you end up working with. Xavier, any thoughts on different residencies?
Well, I think it kind of depends on where you want to work. I think if you want to work in a specific area, doing a residency in that area will help you get a network in that area, and maybe will help with the job search later. But they got different types of residency. They got fellowship, industry, informatics, community pharmacy, managed care. So there are all types of things that you can do a residency in. It doesn't just have to be hospital. It sounds like he doesn't really like the hospital part of it. There are other types of residencies that he can look into and fellowships as well. But yeah, just kind of base it off where he wants to be as well. If it's a competitive job market to get that community job or competitive to get, a more chill type job like he's looking for, it's probably best to do a residency in that area to build your network and gain experience at the same time. And that may help him get to where he wants to be.
Yeah, so still kind of on where they want to go, what they're thinking. And again, initially we're kind of leaning towards, doesn't really seem like they're wanting that kind of intense hospital position there. But I guess also looking at different places that are requiring things. I guess Paige, you didn't necessarily say or know, but it sounds like you have residents, but is that required for ambulatory care? Everyone that you work with have residencies, and do you think those are kind of required for different pharmacy positions, both yourself or colleagues on what you do or other pharmacy positions?
Yeah, I would say the majority of at least newer pharmacists who are trying to get into ambulatory care have at least a PGY1, if not a PGY2, specifically in ambulatory care. I actually got lucky in my role in that I worked in residency at a facility that focused primarily on ambulatory care. Even to this day, we have a very robust ambulatory care program, and they had an opening. So I just kind of slid in there, which was nice for me. But I have plenty of colleagues who have PGY2 training in ambulatory care, and more of a minority, and definitely my older coworkers are the individuals who have gotten into an ambulatory care job who don't have PGY1 or PGY2. And I will say, kind of on the flip side, in that desirable conversation that you were having, if it was a desirable field for your area, I work in a very rural area, and so it's not a very desirable location.
Mm.
And with that, it is harder to get and keep pharmacists. And so the standards, sometimes we are, I think, a little bit more flexible than if you were trying to get in at a big city or something like that.
Sure. Yeah, I would agree with that because Robbie's also talked about kind of how competitive it can be in California areas, but it kind of obviously changes like that, having how competitive it is. I would see specific things kind of as you're saying ambulatory where you even have PGY2s or cancer or psychiatry that can be critical care where that is helpful to have that extra training. But also what you're saying, everyone used to be an RPH and we didn't have all these extra trainings. Like there are those out there that didn't need it. But tying it back to money, like if it takes years, of either doing a residency or your non-residency colleagues who can't remember what the math is. If it's like 5 years that you're saying of just in hospital training to kind of equate to a residency or a year or two of residency. So that just being kind of the trade-off that students got to decide on what they want to do. And then I guess to the future, I know Robbie's mentioned this, but especially in California, but the idea of will residencies be required across all boards, all pharmacists? Will it just be kind of a general almost MD thing where, yeah, they can do 4 years of MD, but you can't really practice right there. You still have to do even a family medicine sort of residency beyond that. So Robbie, do you see that happening? I know it's kind of a little bit there already in California somewhat, but being across the nation on requiring those residencies.
I do, for several reasons. I mean, specialties are always going to require a residency. Like, I can't tell you how many jobs I see online that are like, oncology pharmacist needed, $20,000 sign-on bonus. They wanna board in oncology because they're just so far and few in between. But that being said, the reality of the career pharmacy, there are a bunch of pharmacy schools opening up, unfortunately, and they're sort of saturating the profession as well. I hear from friends who are now professors at school saying how they are lowering the quality standard of applicants they're looking for just to basically admit students because they just want to keep their school open. So I think that because of that, there's going to be a need to sort of separate, the people who have the ability and people who don't have the ability, and just to make up for the saturation of market. It's just going to become more and more competitive, especially as more people try to get a job. We're seeing that here, I'm in San Diego, and there are, there's Kaiser, there's UCSD, there's Scripps, there's Sharp, there's like a Select. There's probably like 3 others I'm forgetting, and they're all cranking out people with PGY1s and PGY2s, and guess where they all want to stay and work? Here in San Diego. So I think it's inevitable, especially if you want to work at a good facility.
Okay. It's coming, is what Robbie says. It's coming.
It's coming. It always happens first in California, and everywhere else catches up. That's the reality of it.
Zay, over with some also California experience, you seeing that as well or feeling that way too?
I think it depends. It depends on the type of job that it's going to be. Like Robbie said, the more advanced careers like inpatient hospital, you'll need more training to actually give the best patient care there. Ambulatory care, like Paige said, it's very competitive. Everybody wants that type of job. So they'll want the most qualified, the highest trained people to get those nice, cozy jobs where they get to have flexible hours and work from home sometimes. Or academia and fellowships, which doesn't require residency, but it does require some postgraduate training to get into that field sometimes. So for those, I feel like it'll be definitely more required just because it's so competitive. And then you have to have a certain amount of training, and that additional training will help you succeed and become a better pharmacist in those areas. Whereas for retail or compounding or consultant pharmacy, like doing MTM for all the millions of elderly people will have, and to kind of keep everything going on the back end, I think we'll still need a lot of pharmacists there who may not necessarily need that advanced training. And those I don't think will 100% need residency unless, like I said, you just want to look competitive and beat other people out for the job. So I don't think it's required. And then also, like Paige said, if you want to be in a more rural area, you may not have you may not need as much of the requirements, or you may not be in a more competitive area like California. So those rural areas who need pharmacists will probably be a little bit more relaxed. And then you have the opportunity to do some of those things without having the crazy training, and you can just kind of learn on the job in those type of situations. So it's kind of like 50-50. It may be required for more advanced areas that involves more patient safety or more complex information, but the stuff that's a little bit less complex, more people oriented, I think those jobs may not require as much training.
Okay. A little split on there on what may be required, different needs across the nation. Paige, any thought on that? You see this coming across the horizon?
Do I think that residencies are going to be required in the long run for pharmacy? I think that there are some people on the medical side that will take offense to that. But I don't think so. Honestly, to be a retail pharmacist and to do like standard pharmacy work, I don't think that you necessarily need a residency. If you want to pursue like higher level type of pharmacy work, like owning your own retail pharmacy, or working in inpatient in specific, like sometimes critical care or internal medicine, or doing like ambulatory care, etc., even psychiatry and even transitions of care. That's a community-based residency a lot of times. There are certain niches that I think do require and would largely benefit from it. But I don't think it's going to be, at least in the next 5 to 10 years, I don't think it's going to be standardized. A lot can change in 5 to 10 years, though. So I could be wrong.
All right. I think I would agree with you. I think just numbers wise, it's so many community pharmacists out there where it's not really required not a lot of, I guess, direct patient care involved, where that extra training can be a lot more helpful. So I would say I would agree. It's probably not happening in the next at least 5 to 10 years coming up here.
You know, they used to say a PharmD wasn't required and it was useless and it should just be a bachelor's degree. Just want to remind everybody that we've been through this before, and there were naysayers. Yes, maybe not in 5 years, but I definitely see it in like 10, 15 years.
I gave a disclaimer. I could be wrong.
You're absolved.
I'm off the hooks.
Mm-hmm.
Yeah. I think we as pharmacists are also trying to mimic the doctor model so that we can become very well trained in our fields and be able to help in our area, our niche the most, right? So, like, yeah, I feel like Robbie could be right, so we'll see.
Wouldn't be the first time I heard that.
I mean,
could be
but
right.
Then it opens up a bigger can of worms, right? Then our PAs and NPs, they function at a higher scope of practice than us, even as like a collaborative practice or scope of practice clinical pharmacist. So then I think they would come first before we come as a requirement.
Well, that's
do they
fine.
have residencies though? Like, I don't know much about their fields.
They do have
like,
some.
They do have residencies? Okay.
Yeah, they do have, like, nurse practitioners can do residencies. I know that. Maybe PAs, I'm not too sure about them, but I know nurse practitioners do. So,
and that helps them do like specialties?
Yeah.
I was just saying, I know that they can specialize. I don't know if it's a formal residency program with like the match and everything like we do.
No, I don't think it's that complex. I think it's more like, hey, this is another year additional training, and we call it a residency, but we help you get more education or more training to get to this specific specialty.
We're a little down the road then, it sounds like. So hopefully
We'll see.
For Gabba Labba RX, we got a little bit of insight for them, something to think about on doing that residency. So we are then moving on to the pharmacy pandemonium, and Robbie will take us away.
All right. Thank you guys so much. What a very fun and engaging topic to discuss. I look forward to see what our profession looks like in 15 years. Hopefully I'm retired by then and don't have to worry about it. But well, hey, you know what? If you don't manifest it, it won't happen, right? So
Correct.
Manifesting.
I will be retired in 15 years.
There you go.
I
See?
get divorced.
That TikTok's going to go viral, it'll pay off everything.
Going to the moon.
No, Zach's going to graduate residency.
Then you get to quit. Yeah. All right. So this week's story is written by someone by the name of Gizmoofdoom. Gizmoofdoom. No idea what that means, but it's kind of fun to say. And the story had this old guy come in and yell at staff because his wife took her first dose of Z-Pak rectally, and she now had the, in quotes, screaming cheetahs, as he called it. Yes, you did read that correctly. Rectally. My staff pharmacist asked how long she was able to retain them before the screaming cheetahs happened. He yelled, "Are you mocking me?" And he tried to explain that depending on how long that it was up, the booty, that would determine if it would be retained or not. She took it rectally because she was at the urgent care and had talked to the doctor about OTC suppositories. We asked the guy why she would think her antibiotics needed to be taken rectally. His answer was that she thought it was a suppository. He just kept yelling until my staff pharmacist had him read the label that was put on the package. He just turned red and stood there. Turns out he was pissed because he had to administer the dose for her. For like a week after that, every time we filled a Z-Pack, my pharmacist would just start laughing when he was checking the... Wow. So a lot of people, I mean, I don't know what, like, who's the bigger victim here, the wife or the husband? I mean, so...
That's not a good husband.
Well, really?
If you would not administer a suppository, even inappropriately, for your significant other, like maybe you should just reevaluate the relationship.
But it's not a matter of not doing it. It's a matter of who's the bigger victim.
He did do it.
Of course you're going to do it. Who's it more awkward for?
Begrudgingly.
Yeah,
But
who's
he was
it more
mad
awkward for?
about it.
Right.
Yeah.
So you should have been happy about it, is what you're saying.
Paige is like divorced.
I love you,
So,
my
like,
dear.
I mean, you got some butt stuff going on.
That's true. It
Across
does
the whole
seem to come
series
up
so far. I don't
Yeah.
know who keeps picking these, Robbie.
I just
I don't know how this happens.
yeah, every time.
It's
It's
not
always
like they've
something.
never seen each other's buttholes before or put something in it. No.
Oh my goodness.
No judgment.
Yeah, that's so you think the wife had it worse then? As my take.
I mean, I still don't really understand. What does screaming cheetahs mean?
I think
Did it hurt?
That was my question.
I'm interpreting diarrhea for some reason as my guess. I don't know. That's a
Yeah,
good
then the
question.
wife.
Hold on. I'm
So
sure there's
that
an
would have been
Urban
her
Dictionary on
first
this.
follow-up there as the staff pharmacist. Explain to me more about these screaming cheetahs.
Hold on. I'm going to see if there's an Urban Dictionary for this right now, because now I need to know what the freak is a screaming cheetah. Maybe this is just like a boomer saying, screaming cheetahs.
Could she be having diarrhea from her infection?
Screaming cheetahs. Let's see. It is a thing. Oh, it says... No, it just says one of the most underrated bands of all time.
Okay, so could be a boomer thing. Depends on that band game.
I think it means we're gonna go with diarrhea. Fans, if you're listening, you think otherwise, please chime in. We want to know what the heck a screaming cheetah is here. So Xavier, I want to hear from you. What are your thoughts hearing this story? And I just want you, as you heard it, I want you to picture you, the husband, and Catherine, the wife, here through the story. Let's personalize it.
Well, first of all, I would have read the packaging.
That's right. You're
And I already
pharmacist,
know
so-
how to take it. But mate, did they deny counseling at the pharmacy? Like, oh no, I got it.
That's
that tends to
hard to say.
happen. Because like we offer counseling to everybody. So apparently he's like, no, I got it. I'm just gonna stick it up her butt.
Yeah.
He left. But then it has to suck though. I couldn't imagine that feels pretty good at all.
Mm-mm.
Not with
Yeah,
those screaming
wouldn't imagine
Cheetos.
it.
Yeah.
Right. And then the screaming, I kind of just feel bad for the patient, feel bad for the husband because he had to deal with the aftermath of it. And I feel bad for the pharmacist for having to hear their story. And I'm mad at the previous person who did not let them know that it was not a suppository. Those are my
Man.
thoughts.
Yeah. How about you, Sam? What's your thoughts as the story was revealed?
I mean, it seems to happen all the time. Little of miscommunications on meds and how things work. Obviously on our minds, it says right there, it says orally, like how easy can this get for you? But it keeps happening. Someone does it wrong. They do take the wrong med, wrong order, whatever it
Job
may be.
security.
You hear it all the time.
Yeah. As I read this story, like two things came to mind. Like we always joke about telling the patient, like, hey, make sure you unwrap the suppository before doing it, because it's just kind of like seems like this should be obvious, but it's like, but also
Nope,
like they
you
really
got-
hammered how that was a counseling point back in school, like take the wrapper off, and so obviously it's happened before, so that
We've had
And then,
patients
of
do
cour-
that where, call back
Really?
and it's like, and then we had I think there was an email, company-wide email to like the pharmacist, like, please make sure part of your counseling thing, because we have like a 2-piece suppository, please make sure you mention that of the things, because there was a patient that tried to use it without peeling it apart.
Oh my goodness, that's terrible. I mean, so yeah, I guess that's why they hammer it home. And of course, the other is they always joke, and this was in Scrubs. It's an analgesic. It does, it's for pain, right?
And
Just a lot of medical confusing jargon here. A lot of confusing jargon. So, Paige, tell us about a time where a patient's misunderstanding led to them taking the medication or treatment extremely wrong.
Hmm.
Now,
It immediately thought of actually two instances that come up with GLP-1s. One was a patient got a weekly GLP-1 and they thought they were supposed to take it daily, and they took it daily for like several days, and then they called and asked what to do from there. And I was
oh
like,
my gosh.
monitor for side effects, I guess. I don't think that there's much guidance on that. And then I also had an individual kind of on the flip side who got an Ozempic pen, and it's a multi-dose pen versus Trulicity, which is a single-use pen. And they had talked to an endocrinologist that told them you get one use per pen. And I was not involved in this patient's care. I just got an alert randomly that the patient kept running out of their Ozempic. And I was like, oh, this is an easy fix. He should just start taking it, for the 4 doses per pen, and then everything will be resolved. And so I, out of the goodness of my heart, was like, let me call this guy and just really quickly resolve this issue so we don't have the back and forth. And then he basically cursed me out the whole time, telling me how stupid I was because his endocrinologist told him that it was 1 dose per pen, and I don't know what I'm doing. And I was like, okay, you do you, guy. Like, I should not have picked up the phone.
Sorry for helping.
Sorry.
Man,
Yeah.
I hate weapons.
What do you know? You're not a doctor.
Yeah. Thanks, doctor.
Don't you know your doctor asks me questions all day?
And then Sam, I know you do compounding. So I think of all of us here, you probably work with patients the most directly, and probably a whole slew of them. So I'm curious, has anything like this happened to you before? I know you just mentioned there's a company-wide email with suppositories, but anything that you personally experienced?
So just GLP-1 wise, there was what came up to mind was someone taking essentially a full 15 milligram dose. So the high end dose after months of taking it as their first dose, not realizing kind of like the difference on drawing up on a compound of like it's all one vial, one use, but they're on the starting dose, but they just went for the full, drew everything out of the syringe or the vial and injected them. So side effects wise, a lot of stomach cramping, a lot of pain from that. They ended up just fine, but that would just made me think of that one thing. But when I was hearing the story, some unique things with compounding, because obviously it's custom stuff that we're doing. But we had one came to mind was a chemo med that we were compounding for a patient, and the doctor called me up and was I can't remember the details, but essentially their labs were all off, and they were concerned, like, let me confirm the strength that we were doing. I was pulling up the worksheets, and all the numbers made sense, and it's like, well, these tests are way off. You guys did you test this for potency? And it's like, no, not this one. Like, it's nothing seems irregular. And essentially they were still adamant on, like, this is wrong. Like, what you guys are killing, essentially you're killing my patient. What's going on here? And they wanted, pretty much I told them, no, we're not going to test it. Like, yeah, you're saying this, but I just reviewed all the paperwork. It all looks good. Like, this, doesn't really make sense. And so they asked me to give them information on testing facilities to essentially test these custom capsules we made for them in the rest of their container. So we have a couple places we send our potency stuff to, but it's like, yeah, I'll tell you who we do, and then the other places. So looked up a few different places in the area, tried to find someone local for them, and then called the doctor back saying, here's my recommendations for you on where you can go. Here's where we use. It's over in Oklahoma. You can use this place here. And essentially at that point, the doctor was like, oh, no, I think we're okay. So it turns out that the patient was taking it twice a day, and it was a twice weekly dosing, and like just obviously huge difference there. And looking at the script, it's like, yeah, it clearly says on the bottle, like they had the bottle there twice weekly on the capsules, and the patient was they were giving them to him twice daily. And so that kind of ended that concern about the compound being way off and wrong. But that came to mind there.
Wow. It's always the pharmacist's fault up until they realize it's not, right? It's like they want to point fingers at us, but Jesus Christ.
We're the first people to get the blame, for
yeah.
sure.
Also, like, why didn't the doctor follow up? That just seems rude. He just came out guns blazing like, yeah, were you screwing something up? And then it's just like, oh, I was wrong. I'm just not going to say anything about this, and I hope you just forget about
or anything.
Yeah, wow, dude. That's very rude. Very rude.
They were just focused on their patient.
Yeah.
What rude.
That is rude. That is rude, man. Don't want to blame
You
the
guys don't
patient,
get the
I know.
TikTok reference.
No.
Sorry,
please
we're
enlighten,
boomers.
please enlighten us.
Maybe our wives.
Come
You know
on,
what?
guys.
I'm still trying to learn TikTok. You know, like it's
There's a
you know,
trending sound. It was like
okay.
a couple weeks ago, and it goes, "That was rude. That was really effing rude."
I think I've heard that one,
Yes,
actually.
yes.
I think I've heard that one.
I just needed the attitude in there and the voice, and it came to me.
Yeah. You're welcome for that.
Thank you. We're now up to date on our
Yes.
TikTok
You guys
lecture of the day.
gotta quit being so old. Come on, I'm the oldest one here.
I don't know if you are actually.
Not in the
I don't know
game.
if you are.
I think I'm older than you.
I don't know if you are. I think your compadre Sam over there might have us all beat.
Sam
I
and
don't
Robbie
know.
are both pretty
I
old.
know
possible.
you're close to
I'm
me,
the baby.
Robbie.
Okay.
I actually have a birthday next week. The big
Wow. Happy
How
early
old are you
birthday.
turning? Is it
33.
okay to share? Yeah, I'm older than you.
Yeah. They're both
You're
older
older
than
than
you.
me?
I'm also
Yeah.
older than you.
Yeah, they're both
Yeah.
older than you.
Okay,
You know,
I'm a bit. Well, you
Well,
guys
no,
are
I think
old.
Xavier's the
now.
baby.
I'm the baby still, but
Yeah, we're little baby
We can be babies together.
we're the same age right now until your birthday. But
When's your
I'll
birthday?
take it. Wednesday.
Wednesday.
Nice.
Okay.
happy early birthday.
Yeah.
Come on, everybody in the chat, wish Paige a happy birthday. We don't have chat, but everybody in the chat do that.
If they were
Someday.
there. If they were there, they would.
Yes.
Yeah, I'm
We
sure.
gotta go live.
You guys
So-
do. I will co-host a live with you. It's easy to. I mean, you guys could all get on live, but I digress. That's outside of the.
One day. Let's get back to the topic.
One day, yes. Okay, well, last question, then we can talk about all the TikTok we want here. So, question for you guys, and we'll start with you, Paige. Obviously, this could have been solved with some patient education, right? Like, obviously, if someone sat down, explained it, don't put this in your booty, put this in your mouth hole, your feed hole, not your exit hole. Besides that, how do you think this could have been avoided? Do you think patient education was the only way around this?
I don't even know if that would have helped all that much. Like, it very clearly states it. Of course, it might have helped, but I think that maybe it was user error more than anything. I think that the doctor and the discharge summary probably indicated by mouth. I know that bottle didn't say insert rectally, so I don't know that there's a lot we could have done.
Yeah, I would agree. How about you, Xavier? What are you thinking? How would you have handled this to prevent this?
Yeah, I mean, I agree. I think patient education is probably the best way, but they probably deferred counseling or didn't want the counseling. Hey, I gotta go, It's time to go get this steak dinner. Me and my wife are going out. Or
You're not a real doctor. I don't need to listen to you.
Just put it in the bag.
Yeah, just put it in the
Throw
bag,
it in,
bro.
that's what we do.
Yeah.
Throw it in the bag.
Throw it in the
baby.
bag. I'm shoving this up my butt. You can't tell me otherwise. That's what he was
Maybe.
thinking.
Maybe a little thing going on. Like, hey, what if we shove this up your butt?
I think
Would
people
that
have
make you feel better?
weirder things in their butt just to see.
Right. People put weird stuff in their butt. I think.
As long as it's flan.
Genuine question here. And I want to go back to this point in the story where I am questioning. It says the pharmacist was asking how long it was in the butt to know if it would be an adequate dose or not. Can we just like I feel like that's not a thing, It's
No,
like
it's a thing.
Yeah,
That's a thing. That's a thing.
That is a thing.
That's a thing.
Okay,
Did
but
they
is it a
crush
thing?
it? Yeah,
It's
I
drug
think it is.
absorption, but which antibiotic? Is the molecule too big to absorb?
It was a
Here's the thing.
azithromycin, I thought, right?
Right.
Is
it's
it- yes.
azithromycin.
Yeah, it was
But
Z-Pak.
is it a thing enough? Is it a thing enough where you would count that as a dose, or just give this guy a whole new freaking
I
Z-Pak?
mean, you probably get a new
Start
Z-Pak.
over.
You
Yeah.
probably get a new
Him to go
Z-Pak.
back to the doctor who prescribed it, honestly, and consult them. And if they want to submit a consult to their ID clinical pharmacist, then that's fine. But that's
I don't
Yeah.
think this is an
I-
ID problem. The PCP can take care of this.
Can your colon in your rectal break down a capsule to absorb it, or are you just gonna
Well,
crap
it's a
it out
tablet.
before?
It's a tablet, right? So I
I thought they come in. Do they? Are they
No,
tablets or are they
azithromycin
capsules?
tablets.
We
They're
have tablets.
Okay.
Okay.
All
Hey,
right.
now,
I'll do
come
a
on, Robbie. I
capsule.
just spent a lot of Z-Packs from the
Come
hospital
on.
ER. Come on.
All right, I know, man. I can tell you about Haldol, but sorry.
But no, I mean, I think the pharmacist just being big brain there. He was like, maybe they
Let me see how
absorb
I can
some
help
of it
them. I'm going to help
rectally.
you.
Yeah.
I
Well.
honestly, even if they took like part of one extra dose too, probably better to just redose it. But
Yeah.
I agree.
Yeah, that just seems silly to me, but okay. Just yeah. Like, hey, how many went up the butt? So you only need half a day's worth more orally. Like, no, dude.
I'll send you some notes on rectal absorption, so you can
Please do,
get your
because I did not know this
you
was
know?
a thing. Please do. I did not know you can just stick azithromycin up your butt. I didn't know
no,
that was the thing.
I don't
I don't
recommend
think
that.
anyone is recommending that, actually, Robbie.
But you guys are telling me it's a
Just,
thing.
like,
No, I'm
but
just
I
saying
think there
some
are some
medication.
medicines that you can,
You
like
can
some
take Tylenol,
tablets.
right?
Yeah, I know, like progesterone. I know you can, do that PV for sure.
Tylenol?
But
Robbie,
I
you
know,
didn't
but-
see the TikTok?
No, I didn't,
There was a
man.
TikTok on it.
There was a
You
TikTok
had to
on it.
click-
Oh my gosh, learning so much.
We're gonna make a TikTok and shove stuff up your butt, Robbie.
That's
Okay.
a good.
Too far,
This is
too
an
far.
exit only. Sorry, man. This is an exit only. Okay, I'm gonna pass.
I
Alright,
think
we're
your
going too
account would
far.
get
Yeah.
banned.
What?
The account would get banned.
Probably, I would ban it on my own behalf. I think.
All right.
Yeah.
We will not do that. That's some Black Mirror type stuff. So we're
Yes.
not-
Okay, well, on that weird, awkward note, enough of talking about butts and mine in particular. Let's go ahead and end the show there. Guys, thank you so much for listening. I know it got a little weird there at the end. We'll see how much actually makes it in the final edits. Probably all of it, but, we'll see. Sam, please take us away.
Please like and subscribe. If you're whatever you're listening to, TikToks, Spotify, please hit that subscribe. Does help. At the Rated RX Podcast, Instagram, whatever you're streaming, looking at. We love the support. Xavier?
All right, everyone, be sure to write in and send us some questions online on our website or shoot us a DM. Tell us how you like our guest today, and just let us know how we're doing, and give us a rating on all those as well.
I can be found on TikTok or Instagram at Paige_KM or on YouTube as at The White Coat Couple, which features Dr. Z Mead.
Awesome. Thank you so much, guys. Until next week, we'll catch you later. Bye.
Peace out.
Peace.